I think there's a common misconception that because you feel fine, you don't have heart disease. So 60 to 80% of people can have blockages and have no idea, right? And so 50% of people who have heart attacks, that their first symptom was a heart attack.
Dr. Shah, it is so good to have you here. Welcome to Longevity Edge Deep Dive. But our relationship goes far beyond having you here. And in fact, it is so cool because last night before we had dinner, we looked at our text messages and we said, when was the last time we even really had a meaningful conversation via text? Because time goes by so fast. And it was 5 years ago. And you were the first person I reached out to when I knew I got my heart transplant. And what could I do to be healthier with my heart, with this new heart? And so it is so great to have you here. You're not just one board certification, not two, but you're triple board certified cardiologist, holistic healthcare specialist, lifestyle medicine specialist. So tell me a little bit about your practice. I really want to understand your practice being an integrative cardiologist. My background is integrative oncology, which everyone knows more about that, but people haven't really shined a light yet on integrative cardiology. So it totally gives me chills to talk about this. And I'm so excited to have you here because your message is a big one. It's this beacon of hope. Heart disease is the number one killer of both men and women. And so tell me about the difference between integrative cardiology and traditional cardiology.
Thank you, Dawn. So glad to reconnect with you. I love being here. So thank you for having me. So integrative cardiology, it's so if you take cardiology, as you know, just traditional testing, stress testing, caths if people have heart attacks, drugs for high blood pressure, drugs for cholesterol. So that's how we're trained, as you know. And as I started practicing when I moved to Jacksonville, I was very dissatisfied with how I was actually practicing. In the sense of if a person came to me and said, I'm having chest pain, I'm having fluttering, and I did the tests that I was trained to do, and I couldn't find anything, I kind of sent them on their merry way because I had no answer for them. And so when I started diving deeper into this, I said, well, there's other things that might be going on. Like, are you stressed out? What is your exercise routine like? What kind of foods are you eating? Are you supplement deficient? But I had, in med school, as you know, we don't get any training for what to eat. Definitely not supplements or vitamins, maybe a touch of exercise, definitely not stress management. So I decided to get board certified in holistic integrative so I could actually do it the right way. And it's been a phenomenal addition into the practice because, as you know, when we just look at the patient on the surface, we're missing so much of what could be causing, even if they do have high blood pressure or coronary artery disease, what's behind it, right? What can we do besides just drugs to help them live a longer, healthier life?
I mean, it just means so much what you're saying. And when we look at healthcare spending in America, we spend over $4.1 trillion on healthcare expenses, and only 97% we know is focused on all of that that's related to this reactive care. And then that 3% is what you're doing, right? And so it's so hard. So you had to go in this concierge model is what you're doing now. So you can dedicate the time and energy so that people could be there with you to discuss this prevention model. And I mean, the statistics tell us that 90% of cardiovascular disease is entirely preventable. It doesn't even have to happen in the first place.
Correct.
If people were able to know how to take better care of their bodies or to understand their innate risk factors. So when you have folks come in to see you, what are the typical tests that you do to start off to find out if their heart is healthy or not, or if they have these risk factors, or if their family history beyond just knowing mom and dad, brothers, sisters, and uncles, if that's playing into it? What type of testing are you doing?
Yeah, so that's a great question. And the reason I left traditional, hospital-based practice was because it's very hard to do any sort of integrative cardiology or integrative anything in a 15-minute appointment, right? And so in 15 minutes, we are trying to talk to the patient, find out what's going on with them, figure out the testing. That leaves no time for diet, exercise, supplements, and the root cause of what's going on. So that's why I left the traditional model, so I could actually spend more time with patients and have that one-on-one approach. And a common thing I often get when I get phone calls, so I do info calls with patients just to see, what they want to see me for, if I'm a good fit for them before they join my practice, is, well, I'm healthy. And I don't really have that much of a family history or exercise. I hear a lot of the same. I exercise, I think I eat good, but I want to make sure I'm okay, right? Or, my spouse saw you and now I want to see you. I think there's a common misconception that because you feel fine, you don't have heart disease, right? Oftentimes people don't understand that you can have, so 60 to 80% of people can have blockages and have no idea, right? And so 50% of people who have heart attacks, that their first symptom was a heart attack, right? So it's because a lot of people are like, well, shouldn't I get a warning sign? Should not? Yes. If you're lucky, you'll get a warning sign, right? But 50% of people, their first sign of even having any blockages at all is a heart attack, unfortunately, right? And so oftentimes people will come to me and say, well, I had a stress test. I had all my, check on the box. I had a stress test. I had an EKG. I had some basic labs and everything was fine. I said, well, that's great. I said, but that's very scratching the surface, right? Let's go deeper into what do you actually have going on inside.
And so when you check labs, what labs do you feel are the most important labs for the listeners to ask their doctor to check on them?
Yeah.
Where do we start?
Yeah. So traditionally, we all know what it's a lipid panel, right? Everyone knows the LDL, is a quote unquote bad cholesterol. There's HDL, that's the good cholesterol, and the triglycerides. That's the traditional panel we've been doing since we've been in med school. Longer, right? But we're in 2026, so we got to move forward. So the panels that I think should be checked are ApoB, right? And I can explain what ApoB is in a second. Lipoprotein A, that's a genetic marker. You want to get your insulin resistance score checked to see what insulin's doing in your body, metabolic health. CRP, which is a marker of inflammation. I often get times if I can do more, I'll do an oxidized LDL, I'll do homocysteine. And that doesn't include, some of the vitamin panels and stuff that we want to check as well. So that's my basic lab. Sometimes I'll dive a little bit even more deeper depending on what's going on with the patient. But yeah.
Well, I love that. And, we do the same exact labs here at Fountain Life. And it's so important. But what we're seeing is that the majority of people are just getting the basic cholesterol panel. And what's even more important is when they do that, they'll see the HDL is okay, the LDL may be marginal. And sometimes the triglycerides are up and they don't even pay attention. When it's in the basic cardiovascular panel that folks are getting, the triglyceride is probably one of the most important markers in that panel if that's the only thing they're getting. But I agree, looking at the inflammatory response is so very important. But you said you were going to tell us about ApoB.
Yeah.
I would love that. I think it's important for people to understand where we really want that range to land for optimal health, for really pulling down and reducing that plaque.
Right. And the way I explain LDL, right? So if me and you, well, we're pretty healthy. But if you take two people who have the same exact LDL, am I going to treat them the same, right? Am I just, hey, there's your number, here's your drug, right? And that's why I don't believe it, right? I feel like medicine should be very precision-based. Every person has its own individual gut microbiome, genetics, what they're doing, what their lifestyle is. So how can we treat every single person the same because their number's the same, right? And so LDL to me, again, is just one marker. And if you really look at plaque buildup, blockages, LDL is just one piece of the puzzle. And it's a piece of the puzzle for sure. All the studies are based on LDL, so everyone knows LDL. We're never going to not check LDL. But ApoB is kind of the mothership of all the particles that can cause the plaque buildup, right? Yeah. So why not, when the way I explain it is I'm always going to check LDL. LDL is kind of in my side mirror, right? But ApoB is right front and center.
Oh, I love that.
Yeah, it's right front and center because I got to make sure that your ApoB is actually going lower. And you asked me for targets. Yeah. So just like anything else, just like we have LDL targets. So someone has no coronary disease at all, and we'll talk about how we find that out in a second, is I want their ApoB in general protective for their brain, the rest of their body. I want it below 90. Okay, that's for general prevention. Now, the minute they have any sort of blockage or plaque buildup, even if it's minimal, I'm going to drive that lower into the 80s. And then if I know for sure they've got significant plaque or they've already had an event, right? They've already had a stent or a heart attack, I'm going to drive that into the 50s or 60s for the ApoB. Yeah.
Well, I think that's so important. And I love what you just said about the brain, because, in traditional medical models, it's so siloed. You have a heart, you have a brain, you have a GI system, you have cancer risk. But no, it's a whole holistic approach to care. And the same things that drive heart disease are the same things that drive dementia, are the same things that drive cancer. And so we know that we can eradicate all these chronic diseases by 70 to 90% if people just lived a little bit healthier. But before we get into that part of what we had the best dinner conversation, and we could have just shined the camera right on our dinner conversation for everyone to hear. But I want to understand more of the functional testing, stress testing, calcium scoring, and then what I think is just so important is the soft plaque analysis with AI. Can you talk us through that?
Yes. So one thing to really understand is that a stress test is designed to pull out a blockage that is obstructive, meaning that is 60%, 70% or more. So oftentimes, many times, people say, why would they not say, I passed a stress test, I'm fine. But yeah, you're fine. You don't have a 60, 70% blockage or more, but that's all we know, right? That's all we know. So I really don't get stress tests anymore. I do. I'm not saying I don't. There's a huge use for it, but it's in a very specific patient that I'm just like, what's going on when they exercise, right? So I don't just, if someone comes in and they want to know their risk, I'm not ordering a stress test. Like, what's the point, right? I already know most of them are exercising. They're doing something. That's their stress test. So that's a stress test, right? Then we look at the calcium score. Okay, the calcium score has been around now for 20 years or so, more so in the limelight in the past 10 years. And that's a great test to look at. It's a simple test. It takes a minute. There's no contrast given, very little radiation. And it's a great test to look at plaque buildup, right? But what it does is it looks at hard plaque buildup, right? Because it looks at when you look at a blockage, plaque, whatever you want to call it, there's hard, and then there's soft, and then there's really soft. And the way I explain it, just so it makes more sense, is if you have a pipe of water, right? And obviously, if the water's just flowing through there and there's nothing else in there, that's ideal. That's what we want for our coronaries. If you've got hard rocks on the bottom, water's still flowing. There's rocks there. As long as they don't keep piling up, we're probably okay. If you have sludge on top or sand pebbles that are unpredictable, that can go everywhere, that's what causes those sudden heart attacks. Now, back to the calcium score. So if a calcium score is 0,
and that's the hard rocks.
That's the hard rocks, correct.
Okay.
That's all you can see.
Are hard rocks.
You can't see anything else. But we know if you have hard rocks, you're going to have sludge. We don't know how much on the calcium score, right? So that's why if you have a calcium score of 0, that's good for the most part. I tell my patients, they're like, I have a 0. I'm like, that's great. Not that I want to be a Debbie Downer. I'm like, that's great, but let's know more. Let's be really, really confident that you don't have the soft sludge stuff, right?
Because the soft sludge is what we have to really be concerned about.
Correct.
And we're essentially missing that potentially
on a
with
calcium
the
score. But calcium scores are easier to access, right?
Sure.
So if you're going to get one test, I would say get a calcium score. If you have to only get one test, and a lot of doctors are comfortable ordering calcium scores now, right? A lot of just, primary cares are not maybe as comfortable ordering a full-on coronary CTA, which we're going to talk about, but a calcium score is easy.
When should people consider having their first calcium score? And who should do it earlier than that normal range that people should start?
So most of the studies are guided around 40 to 75-years-olds. If you look at the guidelines, it's 40 to 75-years-olds with an intermediate risk. So meaning like you have something. You have high blood pressure, you have family history, you have a little high cholesterol. Those are who you usually will get the calcium scores. Now, the thing is, a 40-year-old and a 75-year-old, their coronaries are very different, right? So I would expect if I have a 75-year-old who has a calcium score of 0, I'm pretty comfortable with them, unless they're having some symptoms. We're pretty comfortable not having to do more, right? Unless they want to have more. 40-year-old, 50-year-old, 60-year-old, I read CTs. I can't tell you. I would say 10 years ago, I would take a 65-year-old calcium score of 0 and be like, oh, you're great. This is amazing. You have 0. You're 65. I now read these CTs, right, of actual CTs, coronary CTs, where you get contrast and you can actually look at all the heart arteries. And there's 65-year-olds, their calcium scores are 5. They're getting a pat on the back, but they have tons of soft plaque everywhere.
So
right?
So
I'm like, okay, maybe we're getting younger. We have longevity. So maybe that 65 should be 75 or 80, right? So that's the calcium score. So anything basically above 0, you have some plaque. Line.
And we do the soft plaque AI analysis in our practice here too. And we find that 23 to 28% of those individuals we're screening are people that never would have known that they had this disease if they didn't have this AI assisted advancement in the science. And so I think it's so important. And, it really strikes personally home to my own family history because I had a loved one who died of sudden cardiac death. And these are the kind of things that we can prevent, so our practices, these integrative practices, these concierge practices, these practices that aren't just based on longevity, they're really there to help to ensure that people can have long, healthy, meaningful lives on earth. So let's break down how people do this because, you get these numbers and you find out you have the soft plaque or you have some calcium in your CT score, your cholesterol's a little high or blood pressure. I think we forget about that. We get so fancy, but my gosh, it's easy to check a blood pressure.
Right.
So maybe we should just pause there for a minute. What should people look for in their blood pressure?
Yeah.
What's a good blood pressure?
Yeah, so ideal, right? 120 over 80. I'll take a little bit higher sometimes. I'll say, okay, 125-ish. I'm okay with that on the top number. Bottom number, I want it 70s to 80s. And yes, and that's the thing. Oftentimes, right, we go to the doctors, we have a white coat, even if we're not wearing a white coat, and the blood pressure's high. So I have a rule with my patient, I always have, even when I was in my other model, is I need you to check your blood pressures at least once a week at home. It takes 2 minutes, right? And at least then when you go to the doctor, you can say, hey, I know it's high here, but I check them at home and they're fine. Because oftentimes people have white coat, high blood pressure, and high blood pressure goes silent for years and years and years and years until the damage has happened in the vessels, stroke risk, heart failure, thickening of, that's a one muscle we don't want to get big, right? We want our biceps, triceps, everything to get big. We don't want our heart muscle to get thick or big.
Yeah.
And high blood pressure can do it.
And I think the physiology there is so important because if the heart has to beat out against this huge pressure, that muscle does get bigger.
Yeah, absolutely.
And it's so easy to understand that. So when folks have high blood pressure, what do you think about sodium? There's a lot of, talk about sodium, and some people are actually encouraging hydration. You need more electrolytes, and they're driving sodium up. And my concern is the average American, some are getting upwards near 10 grams of sodium a day. It's such high amounts. So what is your thought on sodium, and what should people kind of dial into when it comes to their sodium goals?
Yeah. So, if you look at, ideally, you want someone who has, whether you have high blood pressure or not, right? You want to try to keep your sodium levels 1,500 milligrams, 2,000 milligrams. Now, that is just kind of a base number, right? Yeah. If you're sweating a lot, you're working out a lot, you absolutely need to increase your sodium. Patients with high blood pressure, I'm like, we gotta walk the line. Because if you do too much, your blood pressure is going to go up potentially. And so 30% of people are salt sensitive, meaning they eat too much salt, they get puffy, their blood pressure goes up. Not everyone is salt sensitive. I don't know. Let's do an experiment. Cut back on your salt. Let's see if your blood pressure goes away. Yeah. Right? Because I get I get patients who don't want to be on all the drugs, right? Doing the holistic integrative part. They'll be on it if they have to be, but they really don't want to be. So the first thing to dive into is obviously the lifestyle. Part of that for high blood pressure is a sodium.
That's good.
And I also have, as you know, if you're low in sodium, do you get Charlie horses? Are you getting lightheaded? Are you getting dizzy? If I hear that over and over again, I'm like, you need more sodium. You need more salt. You need, however you get it with Himalayan, Celtic, electrolyte powders, whatever, you need more sodium. If you're getting Charlie horses and you're getting lightheaded and dizzy, that's your sign. It's too low.
Well, here you go. You're really highlighting the importance of precision medicine.
Yeah.
So we hear recommendations out there, but you really want to speak to your care provider and then individualize those recommendations specific to your needs. Because if you are a runner, we're here in Florida, it's hot, it's winter, but it's still hot. So you have to be aware of those insensible losses or the sodium losses. You talked about Charlie horses or cramps.
Yeah.
I think there is a lot of focus on the sodium. And sometimes people miss, other important electrolytes like potassium and magnesium. So, that's another really important thing that I feel that people need to pay attention to as well. And when you're getting more of these plant predominant diets, you are getting more levels of potassium when you're consuming that. And then of course, magnesium, 50% of Americans have insufficient magnesium intake. And it probably doesn't matter as much what form of magnesium you're getting, just get the magnesium. I know in my clinical practice, I really like magnesium glycinate at night because the glycine gives that nice relaxation property, which I think is wonderful. And I know that some people are a little GI sensitive to magnesium citrate because it can increase, bowel movements. Even we use it for constipation. So I think it's important if people are taking magnesium to talk to their care provider about which magnesium they'll be most tolerant of, if you may. But magnesium is an important one. And I really have a lot of my patients take that. Do you have it?
Oh, yeah. That's my number one vitamin is magnesium. I pretty much put everyone on it. Like you said, there's so many different forms of it. Yeah. Glycinate's my calming, get some sleep. Taurate's actually more of the cardiovascular. It helps with lowering blood pressure. If someone has a lot of stress, I use a magnesium threonate, right? Because that's the only one that washes the brain with magnesium.
Yeah, it crosses that blood-brain barrier.
So it's good for stress. And if they are constipated, then, use the citrate one. Yeah, so there's a lot of different, it's confusing.
It's cool though if you can use one thing for two.
But don't use oxide, right? No magnesium oxide.
That's right, because if the bioavailability is just poor, you just kind of you just waste it.
Yeah.
Okay, so we talked about the electrolytes, we talked about the blood pressure. Now I would love to talk about what are some lifestyle recommendations when it comes to saturated fat, fat regardless. Let's talk about polyunsaturated fats that you want to focus on or reduce when it comes to these LDL cholesterols and ApoBs, because gosh, you have people out there talking about carnivore diet, keto diet, don't worry about your LDL. And we know that we have many, many decades of science that tell us that LDL is linear with heart disease, that we do not want that number to go crazy. And we know now that the ApoB is equally important, but it correlates with the saturated fat.
Yeah. And so that's again where every individualized person is different, right? So when you talked about, when we were looking at what do we do for testing, right? So my standard testing, if I have to get a standard testing, is a coronary CT. Right. So I'll always want to get that as opposed to a calcium score if I can. So if a patient can have a CAT scan, they get the contrast. We can actually look at all the heart arteries. Not only is what kind of blockage do you have? Is it the hard rocks or is it the sludge or is it the sand pebbles? When we add AI technology on top of the CT, we can get even more detail on how soft the blockages are, right? So when we get the CT, we're looking at not only the kind of plaque you have. Is it soft or hard? We're also looking at how much is it pushing in on the artery, right? So about 20% of people who have heart attacks, their blockage on their CAT scan was 20% or less, right? And so that's important. So a lot of times we're like, oh, they've got a, 5-10% blockage. They're fine. Maybe, maybe not. Again, that's that maybe, maybe not, right? And so we get the CAT scan. And the other reason that's important to get the actual, whether you add AI or whether you just get the coronary CT, is what are our targets, right? So oftentimes when we get these labs, LDL, ApoB, CRP, but then what? Am I just shooting a dart saying, here's your medication, but what's my goal? What are we trying to do here? What number are we trying to get, right? We have to have a specific number. And the only way I can know what number to get you at is if I know what's going on in the heart artery. So I can say, okay, this is our goal. And I also don't want in the future, let's do your diet, let's do meds if we need to, let's do supplements. When we recheck this, I don't just want your numbers to look pretty on paper. Like, what's the point? I have to have your carotids not have plaque, and I got to make sure your heart arteries are either stabilized, right? So our goal at the end of the day, the biggest question I get after a scan is done is, how do I get rid of this, right? That's the biggest question.
That's right.
I don't want this here. How do I get rid of the sludge and the sand pebbles and the rocks? Rocks are very hard to get rid of, okay, because they're there, they're kind of stuck. It's very hard to reverse rocks. Sludge and sand pebbles, that's where we want to get people.
And in that hopeful message, like this is reversible.
This is reversible.
The soft plaque.
Yeah,
right.
We can regress. We call it regression in medicine, reversible, however you want to call it. So our goal is twofold. Best case scenario, we reverse it or regress it. And then if we can't do that, we at least want to stabilize it, right? Because if you've got a 20% blockage, 30% blockage, I want to make sure that's not what gets you at the end of the day.
Right.
You can live with that. You're going to have no symptoms. There's enough supply for the demand for your heart because water's still going through, blood is still going through. That's our goal. Stabilization and reversal. Now, when you asked about how do we do that, so this goes into the lifestyle, right? And so one of the biggest things is diet, right? So diet is, and what's diet, right? There's, like you said, there's so many diets out there. But why do we care about diet? Like, who cares about diet? Because as far as cardiovascular disease and our numbers, we know that what reverses plaque or reverses blockage is lowering your LDL, lowering your ApoB. And that's the same point as precision medicine is if I have someone who has a very high LDL, 150, 160, 170, and everyone's trying to put them on medication, I was like, well, let's see. If you really have no blockages at all and your inflammatory markers that we talked about before are perfect, I might leave you alone. I might literally say, what you're doing is okay. We don't have to, that's where, when you hear about people who are like, who cares about LDL? But who cares about LDL? Maybe. Let's make sure.
Look at the functional testing.
Let's look at the functional testing.
And do you ever worry too, if we just let that LDL and ignore it, that 5 years, 10 years, we don't know when the situation starts, when that flame starts to ignite and then it continues to perpetuate. So, I just feel better knowing that people have these lifestyle elements optimized, and even if the numbers are perfect, I don't know that that's always just a green card or a free pass to say continue on this unhealthy lifestyle, because those risk factors over time will add up in most individuals.
Right. And then when you asked me originally for diet is, in general, right, we know with the PREDIMED study, there's been enough studies with the Mediterranean diet, right? That's been kind of written about all around. And so, I like the Mediterranean it's a triangle I try to encourage people, Mediterranean / pescatarian / vegetarian. So how do we kind of, be more plant-based, but have some, maybe some fish? It's the processed foods, right? It's the bacons, the cold cuts, the deli meats, as far as when you're looking at proteins, right? All those are so inflammatory. Forget about the sodium, right? But it's so inflammatory. Cancer risk, all that, obviously, but cardiovascular risk as well.
Well, I really love that. And there's such great research out there. And my biggest thing and my message to folks is any study you're reading that it just doesn't make a lot of sense and it's kind of contradicting what you hear the majority of experts talking about. Always ask if the study was in humans, number one. I think that's the most important. Ask how big the study was and what are they comparing it to. And the Dietary Pattern for Healthy Eating study was published last March, 2025. And I thought it was such a powerful study because it asked, what is the dietary pattern and what are those foods that really help people to live up to the age of 70 and feel good? Like there's no better question to ask in the medical literature, I feel, when we do research. And it answered everything we knew. And the number, though, was remarkable. It showed that eating this healthier dietary pattern could contribute to healthy aging by up to 86%. Food is medicine. And I think food is love too. And so we just have to find that harmony and that balance. But within this, it said exactly what you said. Get more vegetables and fruits, whole grains, nuts and beans,
fiber,
unsaturated fat. All of those things are fiber. And then, it also talked about low-fat dairy in moderation. But again, dairy is one of the primary sources of saturated fat for a lot. So if you have high levels of cholesterol, you may not want to overdo your dairy consumption, or you want to maybe dial more to that low-fat version. But it clearly, in this very important study that had 105,000 individuals, 66% women, which is great because there's a lot of discussion that women just aren't really highlighted in a lot of the research. But it talked about avoiding salt, sugary beverages, and red and processed meat. So it doesn't mean that you can't never have it again, but it means you just can't overdo it. So for these dietary individuals out there that are promoting these high animal protein diets that are red meat, we want to be very cautious with that if you have risk factors for heart disease. And you brought up fiber, and there was that amazing study last year with 17 million individuals, and it gave class 1 evidence to individuals with more fiber that it reduced heart disease mortality by 28%.
Mm-hmm.
So you really have to pay attention to what you eat. And I just get so excited. I mean, I love to throw out those studies because there are a few of my favorite, and it's never too late to start.
Yeah. And it's interesting, so now that I can have a lot more. So I spend 60 to 90 minutes with my patients, right? And part of that is I have a big screen. Yeah. I have my laptop, and I actually will literally go through their entire diet. And half of them are like, oh gosh, she's Googling it and she's putting it up on the screen. And I'm like, let's zoom in on the ingredients, right? And they're like, oh no. But they want to see it because it's so hard to look through those labels unless you really know what you're looking for. Most people, right? I mean, why would you not just look at the front? Wow, this is heart healthy and this is low fat.
Well, and it says heart healthy sometimes on there, right?
Oh,
and it's not always honest.
Or it's vegan, or, and vegan foods can be super processed. The more ingredients, the worse it is. But so many things, will have sucralose, right? Mm-hmm. Or red dye. Or it literally will say artificial flavor in it, And so it's crazy to actually be able to do that and look at labels. And I always say, listen, the less ingredients, the better.
Do you use the Yucca app?
Yes, I think that's actually that's a great one for people to go in the grocery store and do it with.
The only problem I found with it is if you scan nuts, and I typically recommend raw nuts, not the roasted nuts, not the ones with salt, just raw nuts. Those are going to be my favorite, especially walnuts. Walnuts are probably the best because they're really rich in omega-3 fatty acids, and that's an important thing to talk about actually, are omega-3 fatty acids, because they are really anti-inflammatory. There's great plant sources like walnuts and those great seeds, flax seeds, chia seeds, etc. But a lot of Americans are omega-3 deficient. Do you check omega-3 levels in your patients?
I do. I do check omega-3 levels because if their levels are good, if they're getting enough fish, right, on their own, and I don't need to supplement them. Yeah. But the only way you know is if you check the levels, right?
That's right.
And so I check the levels, and if it's low, or it's really the ratio we're looking for, right? The omega-6 to the omega-3 ratio. And we want that to be as low as possible, right?
Yeah, I really focus only on the omega-3. I really do because, we know that most Americans, like about 44% are omega-3 deficient. 66% of vegans are omega-3 deficient.
Yeah.
Which is really surprising, because the word vegan, I don't like that word. It doesn't explain the quality of the diet. So I like to focus on whole foods, read those labels. I mean, I tell people, I get so excited when I go to the grocery store, and I'm always in there. If you see me in the grocery store, I'm going to be in there forever. I invest a lot of time. We have to invest into our health. It's the biggest investment we can possibly make, both for ourselves and our children.
Yeah.
We're so caught up into, we need to invest into our child's college fund. Guess what? You need to invest into their health now, because what you start to feed them now will matter each decade for the rest of their life. And the food, these ultra processed foods are so hyper palatable that we've actually changed the ability for you to appreciate the delightful flavor of a strawberry. I mean, it sounds silly, but it's true. Yeah. So, we really want people just to kind of step into this. It doesn't have to be 100%, doesn't need to be perfect. It's a progress, but trying to lean in more on some of these.
I'm like, let's do 80-20, right? I mean, if most of your meals are good, not processed foods, go out and enjoy whatever you want on a Friday night, just enjoy it and don't be stressed out about it and cause more anxiety, right? Yeah. Because no one's going to be perfect.
No one's going to be perfect. Most aren't going to be perfect. Yeah. And sometimes I see those that are perfect, they're so turbulent and they have so much stress over it. I don't think that's a good balance.
No.
What I have found in my patients, though, is that a lot of them, they get so excited about it, they start feeling better.
Yeah.
And so then they almost tilt towards really having a really beautifully optimized dietary pattern. And there is no such thing as a perfect diet.
No.
We're learning more what each individual needs. And, in this lifetime, probably in the next 3 to 5 years, we'll be able to prescribe diets that are individualized for Dr. Shah and Dr. Dawn. And I think that's so, so amazing. What about exercise? I mean, I could talk about the food all day long, but there was an interesting update to the Framingham Heart Study about exercise and even brain health, where again, it talks about, yes, the Framingham Heart Study was all about heart, but we just saw that people who exercise in midlife and beyond, that it really reduces Alzheimer's dementia by over 40%.
Yeah.
We know this, right? What's good for your heart is good for your brain, as you said earlier. But what do you recommend for people when it comes to exercise? What are those minutes a day they should do it?
Yes.
Dr. Shah, you drive in, 3-hour drive to come to Orlando and you hit the gym. We call you and say, hey, let's go to dinner an hour early. I'm in the gym. That gives me chills too. I'm so proud of you because you live which you promote. And that is so cool. It's so inspiring.
And since we're talking about diet and exercise, I don't know if you hear this often, but often I hear, well, but I exercise. So I think oftentimes exercise is so important. But if you look at risk for cancers, brain, heart, it's 70% diet, 30% exercise. Exercise is definitely important for so many things. But I always try to tell people you can't out exercise a poor diet, right? Always. But going to the exercise. So if you really look at data over and over again, right? So if you get more than 150 minutes of vigorous, I'm talking about vigorous exercise a week, which is hard to get, right? That's kind of an extreme. You're going to lower your risk of heart disease by 50%, right? So 150 minutes of vigorous. Okay, that's maybe an extreme. The way I explain it, I have 4 buckets.
And that was vigorous. Yeah. So you said vigorous.
Very
so people
vigorous.
Need to hear that because, most guidelines say 75 minutes of vigorous. Yeah. So 150 minutes of vigorous, that is a lot.
That's the extreme.
Because vigorous. It's like
we have some extreme people who want to just do it all, right? So I have 4 buckets is the way I explain it. My number 1 bucket is actually resistance training, right? Especially for longevity, cardiovascular health,
the metabolic health.
The
muscle is going to help use that glucose.
Yeah. So it's resistance training, weight training, whether it's, body weights, calisthenics, doing actual dumbbells, going to the gym, get that twice a week, right? So that's one thing.
That's really big coming from a cardiologist, because for years we would hear cardiovascular experts talking about, cardio. Make sure you're doing your cardio, but it's a balance of both. It's not just one or the other, but you've got to show up in the gym or in your home. And
gravity is going to get us all, right, at the end of the day. So if we don't have that muscle, we don't have that resistance training, we trip on a sidewalk, we're going to fall. We don't have bone health. It's good for bone health, right? So resistance training is probably my number. If I have one thing and it can only do one bucket, I'm like, please do your resistance training. The second's going to be cardio, right? And I'm more of a fan of 2 things of cardio, right? One is interval training, right? I'm very passionate about interval training and what that looks like. 15 minutes twice a week. Again, you're not doing this every day. 1 minute as hard as you can go. 1 minute of recovery, or you can do 4 minutes on, 4 minutes off. You want to do that for 15, 20 minutes twice a week. Very good for VO2 max, right? So VO2 max is our way of seeing how good is your cardiovascular reserve. And it's one of the best tests out there. You can go on a treadmill, they put all these things on you, and then you can check it. But we know that interval training really helps improve the VO2 max, okay, and longevity, cardiovascular health. The other cardio is steady state, right? So I'm okay with go for a walk, get your 10,000 steps in. I'm actually not a big fan of the long distance running. I know you're going to punch me in the leg for this one because I know you run.
It's a lot of oxidative stress.
It's a lot of oxidative stress. Again, if you're training for a marathon, you're doing something, obviously you need to do long runs, but just for more longevity, what it does to our cortisol, what it does, there's just not a lot of bang for your buck to go run 5 miles. Run 5 miles, but throw some intervals in there. Walk for a little bit, right? Kind of do it that way. And then the 4th piece of the puzzle is that stretching, mobility, yoga, just centering, just kind of doing all of that because we're very stiff when we work out. Again, that tripping on the curb example, you need to have good core. You need to have good balance. And strength. So those are my 4 buckets.
I like that. But you weave into the importance of more of a moving meditation with yoga. And I think, when I think of meditation, some folks really do struggle when it comes to just doing deep breathing exercises. And so if they're doing yoga or Tai Chi or Qigong and they're moving their bodies, a lot of times they feel really balanced with that.
Yeah.
Well, I want to ask you, as we close up, just some rapid fire questions.
Okay.
I'm going to put you to the test. You ready?
Yeah, I'm ready.
Okay. So what is the most important cardiovascular test you want everyone to know about that you think a lot of people don't?
Coronary CTs.
Oh, good one.
Get a CAT scan of your heart arteries.
That's good.
Yeah.
Okay. Most underestimated heart risk factor?
Lipoprotein A. We didn't talk about lipoprotein A.
Let's talk about it.
Okay.
This is important.
So this is very important. So when you ask me what panels, what testing should be on panels, ApoB for sure. We talked about that already. Lipoprotein A. Okay, so lipoprotein A is a genetic sticky protein. You either have it or you don't have it. Okay.
Can you reverse it? Can you?
No. Not really. I mean, people used to use niacin. It's, the answer to your question is not really.
It's answering more what you got from mom and dad.
There are some drugs that are coming out probably in the next year or two because we found out that, hey, your LDL is good. Why did you have a heart attack? Oh, wait, what's this lipoprotein A? So it makes you about 3 times higher risk on top of your risk already if you have lipoprotein A. It's a sticky protein. It just makes it way easier for the particles to get into the arteries.
Important.
Yeah.
Okay.
So it's one test. You either get it one time. Just ask your doctor, can I have a lipoprotein A? It's just going to put you at higher risk if you have it. So,
and then you're that person that you're going to need to spend a little bit more time in the grocery store, having food selection, making that commitment to exercising, having some nice stress reduction.
Get your testing.
Yep.
Get your testing.
It's important.
Yeah.
What's one myth about heart disease that you think people, that needs to be dispelled?
I feel fine. I can't have heart problems.
Or I don't have
symptoms. Yeah, I feel fine. I exercise. I feel great. I don't have any heart blockages.
What's your favorite exercise and how do you exercise?
So I am training Muay Thai kickboxing right now.
Ooh,
I am. I get bored easily. So a couple years ago, right when my husband and I turned 50, I said, we need to change it up. He's like, we work out so much already. So we started doing Spartan races.
Oh, great.
Yeah, so that was really fun. And then we finished that. And now I'm doing kickboxing and Muay Thai. I walk, I run, and do weight training. I love Pilates. I try to do it all. I get bored. I got to do something different every day.
Well, I love that you went to the gym as soon as you landed after your 3-hour run. What is your favorite healthy morning add-in that you do before you head out the door?
Yep. Get at least 10 to 15 minutes of natural morning sunlight. And I do a gratitude journal in my head because I don't like to write, and do 10 deep breaths.
Oh, that's beautiful.
That takes, doing a gratitude journal and doing 10 deep breaths, you know how long that takes? Maybe 2 minutes, maybe 3 minutes. But if we start our morning with what can we be thankful for? Because oftentimes we wake up, okay, I got to do this. What's going on? Oh my gosh. And our brains are so hardwired to all the negative stuff, all the stuff. But let's start our brains with that healthy neural wiring of what is there to be grateful for? So much.
I love that.
Yeah.
And, for years I worked with Dr. Amit Sood, and he would talk about the same thing. And he added a few other things to it that I thought were really, really fun too. The gratitude, just that, what are we grateful for? All those meaningful things in our life. What's one thing you want to go really good today? Or, if you do it at nighttime, what's one thing you want to do a little bit better tomorrow?
Yeah.
Because there's always room for improvement. And that kind of keeps our ego tamed, I think.
Absolutely.
And then the one that I really love is send a loving message to somebody, like a well wish. And so I think that those practices are so nice. And I love that you brought up the morning sun, because that really helps to reset that circadian rhythm for the next day.
Absolutely.
That regularity of morning awakening is so important, and getting that morning sun, also getting some sun for some vitamin D is a great thing too.
Exactly.
Love that. And then what's one habit that you think has the biggest return on investment? I think you kind of said it when it comes to nutrition and exercise, but I'm curious if you think that there's just one thing that is really, really important.
I think getting movement, and I think oftentimes a lot of us are sitting a lot, right? Especially people who are working from home with COVID and they're sitting in front of the computer. So movement, I think we're probably the biggest thing.
Well, and I know for so long, I see a lot of individuals where they go to the gym, they get their 30 minutes in, but then the rest of the day they sit.
Exactly.
And I've been guilty with that too. I try to have a standing desk. I try to stand up and move, do some, stand there, have your legs going back, do some leg curls, whatever. But we've got to move our body, be intentional about it. Yeah. I think that's so important. And let's just close out. Like, what are you most hopeful for in the future when it comes to cardiovascular health, cardiovascular medicine?
Yeah, prevention, right? It's know your numbers, know what's going on with you. Don't bury your head in the sand. You don't want to be that person that thought they were fine and then end up with a heart attack. You don't want to be overly concerned as well if you don't for right now, right? You want to get the testing when you need it. You always want to focus about exercise, diet, stress management, so much goes into it. But you don't have to also carry your genes, right? So oftentimes, we know this epigenetic stuff is that just because you have the gene doesn't mean it's going to get turned on. So just because you have the genes, get your testing, make sure you're okay. And if you're not okay, get on top of it. Yeah. You have to be your own advocate for your health. And I mean, in this day and age, if you don't advocate for yourself, Doctors are so busy nowadays, especially in the traditional model. They're in and out 10, 15 minutes. Advocate for yourself, educate yourself.
Yeah, I think that's so important. I love what you talked about genes. I think it's a cliche, our genes are not our destiny. There's truth to that.
Yeah.
Like you said, about 25%. There was a recent study just published that maybe up to 50%. But it kind of doesn't matter because our lifestyle kind of turns on and off these different switches, the epigenetics. So the lifestyle we know has at least a 75% contribution of giving our genes more of a hopeful destiny.
Yeah.
And so I love here for our members at Fountain Life, we always talk about what you said, know your numbers, detect, get that testing. We want to optimize just because the numbers aren't great when you first get them or the test. Hey, there's so much we can do to reverse this and get you healthy. And then let's restore. Let's do these restorative therapies so that you can really have those aha moments, experience your aliveness, and feel good. Oh my gosh, to feel good in your body, it is a reality. It is a possibility. We just have to help guide people there. And where can people find you? It's so inspiring to have this time with you. I just really cherish your friendship. I honor your professionalism and the service that you give to your patients, the time. And it's just really a privilege to have you here with us. So where can folks find you?
So I'm in Jacksonville. I have One Heart Cardiology. That's my practice. And I'm on Instagram, Holistic Heart Doc. I'm starting a YouTube channel, trying to, because I feel like this kind of education, because, in my concierge model, I can only obviously help a certain amount of people. But I really want to be able to educate more about really what they can do. What can you do? How can you advocate for yourself? What testing should you ask for? Even if it's not with me, you don't have to see me. Go see another doctor and ask for these tests and know what you're looking for. So I'm going to start my YouTube channel for that. And then I have a blog, drmonashah.wordpress.com, with all kinds of articles on holistic heart health.
Well, you are a very busy woman, and we're grateful you brought yourself here to Orlando and you took this time with us. And from us here at Longevity Deep Dive, we thank you. And here's to everyone, just live without limits. Be the healthiest version of yourself.
Thank you. Thank you so much.